Hey everyone, good afternoon and welcome to this week's edition of Live with CXPA. I am Gabe Smith, CCXP, and I am the content manager for the Customer Experience Professionals Association, coming to you live this afternoon from beautiful Akron, Ohio in the Midwestern United States. So every week, it is our goal here at CXPA to bring you content that is going to help you advance CX in your organizations, as well as to advance CX in your own careers, whether that's through live streams like this one, whether that's through webinars that you can find at cxpa.org, or whether that's through content in our CXPA resource library where you can find templates and case studies and presentations that are going to help you fuel your CX success. I gotta say, one of the things that I enjoy most about these live broadcasts is the chance to bring you all case study conversations with people who are out there in the field doing the hard work of aligning their organizations to deliver better experiences for their customers. So we're going to be doing that today. Today's one of those days we're going to be talking about how a leading health insurer embarked on a really ambitious journey to deliver better CX through enhanced, streamlined customer communications across channels. But before I bring in our guest today, as I always like to do, I want to hear from you. Where are you tuning in from today? It's hard to believe we're at the end of July, but in this time when so many of us are still cautious about travel, it's always nice to be able to sort of live vicariously and see where you all are tuning in from. So I can imagine what it would be like to be where you are. So let me know, where are you? Where are you at in the world? I want to hear from you. And throughout today's broadcast, the show is always better when you're a part of it. So if you're tuning in here on LinkedIn, whether you're tuning in on Facebook, or if you're tuning in on YouTube, want to hear from you as we go and we have this conversation and it unfolds. Want to hear your reactions, your comments, your questions, and we may sort of bring you in and bring your comment into the show. So let us dive into today's conversation. And hey, I see a couple folks. So I want to call out Luis, Dr. CX, connecting from Portugal. Hey, Luis, good to see you. Kim is from coming to us from North Dakota in the U.S. We've got Hong Kong. Marlene from Trinidad. Welcome, Marlene. We've got Muna, who's tuning in from Saudi Arabia. Excellent. Love to see all of you here. We've got a Hungarian, Andras, a Hungarian originally from Budapest, currently from Kiev, Ukraine. Fantastic. Love to see it. Carlos tuning in from Mexico as well. Keep that coming. Want to see and hear from you. Okay, let's dive into today's conversation. So excited to welcome Neal Keene. Neal is the field CTO at Smart Communications, a provider of a customer conversations management platform. Neal has more than 25 years of experience helping businesses, especially those in insurance and financial services, to modernize their customer communications and business process tools to take full advantage of digital innovation. Neal's worked with a range of clients from small businesses to large enterprises with deep experience in strategic product planning, business development, industry solutions, analyst relations. And prior to joining Smart Communications, Neal held executive positions at Intellidocs, Thunderhead Inc., and EMC Document Sciences. Neal, you've done it all, and I'm so glad that you're here with us today. Welcome.
Thank you, Gabe. It's good to be here. It's good to be with everyone.
Absolutely.
Good to see such a global crowd.
I know. I love it, right? It's so awesome.
Absolutely.
So next, I'd like to welcome Carla Dailey. Carla is a leader in digital transformation, driving business process and technology change throughout her career. She has a combined 30 years experience in healthcare and consumer products industries, primarily focused on CX and operational excellence capabilities. She is Senior Director, Customer Engagement Capabilities at Blue Shield of California. She's been with the company 9 years and has driven major projects to deliver advanced business solutions for customer service, engagement marketing, and she's developed talent and product organizations to support transformation. She's got an MBA and BA in international business. She's presented in many industry and vendor forums, and she enjoys her free time traveling and being in the outdoors. Welcome, Carla.
Thanks for having me, Gabe and Neal. Really happy to be here and agree having this global community presence is awesome. Even though predominantly I'm a Californian, I do love traveling internationally. So it's great to see many faces.
I was going to ask you, Carla, as you look at this list of countries and cities from around the world, is there any here that you've been to as a traveler?
Well, my father's Danish from Denmark, and my mother's British. So I've been to Denmark and England many times. Lived in France for a year, and of course, world traveler. Love Greece, love Mexico, love anywhere I can go in Western Europe and South America. And we can't forget, Canada. They're part of us too, right?
Yeah, absolutely. So glad you both could be here. And, before we really dive into the Blue Shield of California story in more detail, I'm wondering, because we have such a global audience that may or may not be familiar with the nature of the insurance market here in the United States, can you give us some details around, who your customers are?
Yeah. Well, let me start with Blue Shield of California. In the global healthcare industry, it's all practiced differently. And in the United States, we have both a private and commercial healthcare system, which allows us as a healthcare payer, an insurer, to provide health insurance to customers to lower their cost of care. And Blue Shield is actually a not-for-profit insurer, and we're based in California. But we're part of a larger kind of ecosystem of Blue Cross, Blue Shield Association families that have similar health plans across several states in the United States, but not global, but within the United States. And Blue Shield of California offers the health insurance, medical insurance, vision, dental, pharmacy, right now to over about 4.5 million customers. California-wide. We do serve both commercial and consumer markets, meaning that we may have some very large employers that are headquartered based in California that have employees nationwide that we serve. And then we also serve consumer markets that have individual families who need health insurance, and also Medicare. So those are for over age 62. And then we have Medicaid for those who need extra affordable assistance in providing health care for them or their families. So those are the areas that we serve and the markets that we serve in. Go ahead.
No, go ahead.
Yeah, I just wanted to add that Blue Shield of California is a mission-driven company, and our aim is to provide affordable health care that's worthy of our family and friends. And I hope you know that healthcare is increasingly expensive. It's in the billions of dollars across the United States, and in California alone, multi-millions of dollars spent on providing healthcare to people and it's just not affordable anymore. So our mission is to provide affordability and access. Everyone should have access to healthcare, and so it's difficult and it's a complex system. Because in the US and even in California, you have to deal with so many different entities. We have to deal with providers, those doctors who provide care, the hospitals themselves. We deal with different vendors or third parties that we use to administer care and provide pharmacy services or vision services, for example. And then we also have our technology partners like Neal and Smart Communications who are helping us with technology to deliver a better experience. And so all of this costs money, all of this are investments, and they all have to work together. So because we are so mission driven, we also have a mission to transform the industry. And our company alone can't do it, but we will do the best internally to reduce costs and find ways to improve and have better outcomes for people. And but we are also out there to influence and help with our regulators, with our physicians, our hospitals, our provider networks, so that we can better serve.
Yeah. That's fantastic. let me mute real quick. That's fantastic, Carla. I mean, it's you are so right in noting the complexity of the health insurance industry, the multitude of players that are involved, and it's why I'm so heartened when I think about insurance companies like yours adopting CX as a discipline and a practice and a philosophy and a way of being, because you recognize that complexity from the customer's perspective. So I would love to learn a little bit more about the history of customer experience at Blue Shield. Can you give us a little bit of that history and tell us about sort of what's been driving that transformation in the time that you've spent there?
Yeah, and as you shared, I joined Blue Shield of California 9 years ago, and I actually joined it at a time when we were moving off some very archaic, older systems, green screen kind of systems that we had, and I was part of a program to move to a more advanced system, a payer system that could have more visibility around how we serve, how we take claims, how we serve our members, how we communicate and work with our provider partners. And we had to move to a whole new platform, a whole new system. And that really started our customer service experience and our journey and our strategies, because once we were on a system that really allowed us more visibility in how we were going to serve our members, we were able to build out and actually form an organization around customer experience. And then we created some pretty big, bold decisions and ideas of how we want to take where we're at and move to more of a digital age with omni-channel capabilities. And that started probably late 2018 into 2019 with that vision. And while it wasn't a mandate, if you will, it wasn't something that top-down said we have to do. It was something that was part of our North Star and goals of where we had to get to. And our CEO, Paul Markovich at the time, and other key leaders really championed this idea of let's create a North Star, let's have that 5-year vision, that 5-year plan that we're going after, and not only be brilliant at the basics and invest in things that we have to do that we've been starting to do, but also create room for innovation. And if we can be brilliant at the basics and we can figure out ways to lower costs, then we can take that money and invest in the innovation and help to transform the healthcare system and even our own company. There's so much opportunity out there. It's like you can't do it all at once. So after that kind of big, bold statement and where we wanted to go with our North Star, we had to sit down and prioritize. You can't do everything all the time, and you've got to figure out what makes sense. And so even of the latest of last year, we had to sit down and say, what can we do to drive more digital adoption? What can we do to be more automated? And some of the key investments we made was to figure out, how do we collect our members' data, our customers' data? How do we know them more? Do we know their demographics? Do we know their socioeconomic conditions? Do we know their preferences and how they want to be communicated to? Do they want things on email or digitally, or do they want it printed? And so we created a whole, what we call communications transformation initiative. And we built out last year a lot of digital capabilities, even with smart communications, and capturing that contact information, honoring those preferences. And we totally, in addition, reinvented our customers' billing experience with automated payments and communications that are easy to understand and more personal.
Yeah, that's fantastic. And you mentioned this goal of we want to lower costs and improve customer experience. I think that's sort of the holy grail, right? When we can reach those twin goals, that's fantastic. And I'd like to learn a little bit more and kind of take a step back. And Neal, I want to get your perspective too. I'll go to Carla first, but I want to bring you in here. Talk to me about why customer communications are so important for Blue Shield, and what makes it important to the customer? I know, for a lot of CX professionals out there, communications, it can kind of somewhat be a little bit of a black box. Like, I perhaps don't know what communications are going out when, what our customers are seeing when, can have a real impact on CX. So I'd love to know from your perspective, what makes that so important for customer and for your business?
Yeah, and as I mentioned earlier, healthcare is so complex, right? And we do send a lot of communications, one, because we're mandated to. If you sign up for Blue Shield and you have a medical plan, we have to provide you an ID card, right? So we have to send that. If certain transactions that are made, claims that are paid, we have to send you letters and information about what we paid, and what your cost share is in that and what you owe. And so it's very mandated. And in the past, even our mandated laws, regulatory laws, were print. You read them all and they say, and you must mail, and you must mail. And they haven't even gotten into the digital age. And I also think there's a level of complexity in explaining benefits, in explaining your health plan, and explaining why it is you owe money or why it is that something didn't get paid. And so we went on an effort to revise our communications at the 5th grade reading level. So we have to make sure that the communications we do send are very easy to understand, right? And they also need to be personal, because if you just get a generic letter and you don't really know who it's for, your whole family may be on the health plan. And if your name isn't at the top of the page, or your spouse's name, or your sibling's name, or your dependent's name, then it's not personal and you may not know what it's for. And we don't really make things as like I said, easy to read, easy to just take one quick look and really understand what that communication is about. So we're also doing that. We're trying to make things more personal, and we're looking at the end-to-end systems of our communications, like how many letters are going out, how often do we send you an email, things like that can help make sure that we're not over inundating our members with information or being redundant. Like, you don't want to say the same thing all the time, and then they're tired of it, and then they say, unsubscribe, don't send me that stuff anymore. Right. We want it personal, we want it relevant, and we want to make sure that if they are getting communicated to in various channels, that it's consistent. It's the same information, same reading level, same kind of personal experience, so it's consistent in all channels. And we hope for us that that's really going to drive improvements in our customer satisfaction scores, such as Net Promoter Score, NPS here. I don't know if that's used globally. I think it might be, but gaining that loyalty and ensuring that our members feel good, about our health plan.
Yeah, it's so great to hear. And, as you were remarking on the complexity in terms of just, taking the reading level to a 5th grade level, early in my career, I worked for a nonprofit, and, part of my job responsibility was talking to customers and helping them navigate, through their health care experience with the doctor, with the insurance company. And for a lot of people, I'd say, was this a bill that you got from your insurance company? Or it was a distinction without a difference, whether it came from the doctor, the insurance company, whomever, they didn't know. So I love hearing, the steps that you've taken to reduce this complexity. But Neal, I want to ask you, as you reflect on this idea of customer communications, why do you think it's so important, and why do you think that the work that's being done at Blue Shield is so important and impactful?
I think what Carla has covered is representative of what's going on in the industry. To your point, Carla, as we get more into working with the customers and looking at an outside in model instead of the inside out, what are we trying to accomplish? It's more of, what is our customer trying to accomplish? It's got to be personalized, but it's heavily regulated. So we've got to get them the right information, ensure that we do get them the right information in their channel of choice, and be able to audit and have control over that. And the simpler we can make it, the better the outcome is for the customer, for the member. but also the more it improves our end-to-end experience and processes internally within the business. If anything has laid bare the challenges that we're talking about here, and thankfully Carla and the team embarked on this in 2018, last year's pandemic and continuing into this year really highlighted the fact that digital is the way we have to be. We had to be digital from the start, not digital by exception. And what I mean by that is the first phase of the pandemic was get everyone working from home. How do we have business continuity? So one group of users were employees of the plan. They were providers. They were telehealth workers, other people we needed to make available remotely. Then immediately following that, we had the small business employers who in a lot of the cases are the subscribers to the plan. Then the actual members themselves had a lot of questions. Does my coverage include telehealth meetings with my doctor? I can't physically go in. How can I meet with my providers? We're in the middle of some type of treatment. What's next? So it really became about proactive, not just reactive communications. And I think insurance and healthcare has made that switch most recently to recognizing that proactive engagement that is highly personalized, but is consistent in every channel, pays significant benefits back to not only the company, but provides that better experience to the members and to the customers, regardless of where they are. As Carla and the team have done a very nice job of incorporating that into the foundation of how they go to market, how they engage with clients, and as well as providers, the doctors themselves. That has to be the norm. It can't be the exception. And we see a maturity model of you need to personalize the electronic, move from anything that's physical, paper, print and mail, those kinds of things, get it to electronic at least, where email with attached PDFs or just email kind of text messages. But ultimately where we see this going is you need to make it digital. It's two-way, it's real time, it's conversational. So ultimately as we personalize the digital, we need to personalize the electronic. We need to humanize the digital. How do we make things easier and more intuitive for people to be able to access? What are the benefits back to the customers, back to the business, and quantify those benefits? All this comes together in the form of putting together a group, an organization with a remit inside of the business that looks at how do I improve the customer experience? How do I adjust my processes and do a better job of engaging clients, not only communicating with them, but being able to have them be able to respond and tying all that together to focus on outcomes, not just outputs.
Yeah, great points, Neal. And, I'm curious for our viewing audience, for those who have challenges with customer communications and some of the kinds of complexity they're mentioned here, would love to hear from you. If you have any questions for Neal or Carla, or if you have successes that you would like to share, would love to hear that as well. So Neal, you mentioned the pandemic, and I know that you and your team, you've been kind of closely monitoring. You've been keeping your finger on the pulse of customer sentiment throughout. You mentioned, the shift to telehealth and the need to be more proactive with communications rather than reactive. Are there any other trends that you're seeing that you want to note?
I think the biggest one we're seeing is that the customers are in charge. They want you to engage with them how they want to be engaged. So customer preferences. What is the preferred channel? Being able to support the information you send in all channels, the omni-channel approach. Ultimately being able to use that as a stepping stone to an opti-channel. What is the optimal channel to get someone the information they need? Do they prefer during work hours to get things in text? Do they prefer after hours to get things in email? What are their patterns of usage? That comes with time, and that comes with actually being able to engage with them more effectively. I think that plus what Carla was talking about is not only knowing when to engage them and the best channel to engage them, but doing it in a way that's compelling and empathetic and understands their needs. So how do you simplify the language? How do I use plain language when I'm sending out a regulated bit of material? It's a fine line to tread. It makes customer experience, especially in healthcare, more challenging because there are some things that you have to send that are mandated in a certain way. How do you do that, but also help summarize this in a simplified way that helps them understand clearly what you are doing, what is their responsibility, what next steps to take. And ultimately, it's not just about the transactional nature of, okay, you got this care and here's what we'll pay benefits wise, but how to be more proactive in helping you with care management. If we know you have a specific a set of treatments, or you have certain ailments that are long-lived, how do we help you manage those? For instance, diabetes, you have diabetes, or you have obesity, or any of those kinds of things where you need to manage your health. How does the plan help the provider and help the customer and member do a better job of managing these wellness trends and be able to manage those outcomes, know and hear the response back? So making it move from a communication to a conversation so you can collect information and ultimately get to this dashboard, if you will, of additional data about how effective these engagements are.
Yeah. You know, we always talk about here at CXPA the fact that CX is a team sport. It requires talented CX leaders. It requires, great CX partners, like Smart Communications. It requires, executive buy-in. And it sounds like, as you were talking about, the need to simplify, the need to make, complex legal language more conversational. Carla, I'm struck by the fact that, that really is a team effort to, convince all your folks in the legal department that this is a good approach and to actually go ahead and get that done.
Yeah.
Yeah. So Neal, I'm curious, we talk about this team approach. Tell me more about your overall approach to, customer communications management. And, we've talked about the complexity, the regulation in the insurance industry. Is there anything else that, really makes this unique in terms of this relationship?
It is. There's a couple of things that jump out. One is things are always changing. Maintenance updates, regulation changes, just being able to simplify that language and make those updates across any channel is ongoing. It happens all the time. How do we get that out into the hands of the line of business and the business executives to be able to make updates, make changes to content more effectively and quickly, but at the same time ensure that it's consistent, it's been fully tested, have IT almost plumb the infrastructure. So IT is involved to make sure it's architected, the infrastructure is architected well, but empowering the business users to have more control over the day-to-day. That's been a real driver. And then being able to design it once and be able to add new channels quickly. So as I often say, new channels are born every day, but old channels never die. There's still people who need facts. There's still people who need every channel available at some point. So how do we make that matrix of different conversations we could be having with someone consistent and quite honestly easy to maintain, but at the same time make sure it's compliant? That's the ongoing challenge, I think. And Carla, you've done a great job with this, with your team and the Center of Excellence around how do we look for processes and places to make things more efficient and consistent as well. That's the team sport you're talking about. And we see that as a best practice across the board.
Yeah, Carla, I'd love to learn a little bit more about that. What's the sort of, how do you prioritize that, in terms of what you and your team are going to take a look at?
We actually have a enterprise communication governance forum, and it is comprised of all the business areas, legal areas across the enterprise for our company. I think what we can't control is the things that are done outside of us. So what happens in a doctor's office, what happens maybe with a third party, and information that's sent to members that's not from us, but it could be related to their experience of care or of information that is sent to them. So we always get, the brunt of everything coming at us, but we can only do our part, right, to start. So, I don't know if you were going to ask this question next, but I was going to get into just the journey. What about the journey of our member and what they take us through, or what we take them through, I should say, and how can we help having that journey be a better experience across those channels? And see where they've been, understand the communications that were sent to them, so that when they call into us, we could say, oh, I see you did get this letter or this email that was sent. And then we can even drive them more digitally to say, oh, well, did you know this same letter is available in your message center. So if you're registered online, you have an account with us, you can just open up that letter. Or did you know if you download our mobile app, you can access your ID card. You don't even need to have a printed ID card. So we have to inform them and make those digital assets available to them. And at every interaction point, understand where they've been, what they've been communicated to, so that we can continue to, again, not be redundant in what we're sending them, but also guide them to where they should go to access that information that is a better way to access the information. It's more real time anyway when it's digital versus getting something in the mail. But again, I think our challenge here is the healthcare system itself. You know, we collaborate with our providers and vendors. We try to get data information from those constituents to create a seamless experience, but we're not there yet. You know, we have a lot of work to do to create that kind of whole system that can look at that member, that person, and be able to communicate with them across all those constituents. So we're experimenting, we're doing things, we're trying things, we're pushing the envelope where we can, and we'll see what happens. But it's a continued journey.
That's so great, and I so appreciate those insights. And I was actually going to ask you sort of just that question around, you know, I think the insurance industry. Well, we always say, you know, when you're mapping customer experience, you're doing journey mapping and things like that, that you should look at other factors that are involved that don't necessarily involve your company. And I would think, you know, for insurance, there's even more of that because, you know, like I said, for a lot of patients, it's a distinction without a difference as to who sent you this piece of mail or who you talked to. Very even difficult to understand. So great to hear that, you know, you're trying to wrap your hands around that holistic experience, like you said. Getting some great.
If I can add to that, Gabe, there's a lot of different users and people involved. Healthcare is has a couple of challenges that are more unique to it as well. When you start talking about someone's health, it's very personal, but it can also be very emotional depending on what's happening. And there's typically a team effort between the payer and your set of doctors, maybe hospitals, and being able to communicate effectively and clearly at a time that may be challenging for a family or an individual. So that's where customer experience, I think, really has a key impact on, we get the right information, the right data to get the right message at the right time, but being able to be clear about that and do it in a way that is relevant and personal, as you talked about, Carla, is kind of the key to being able to reduce costs, but also improve that experience. So when renewal comes up, or as people come back into the plan, maybe potentially later on, they have a good understanding, a good experience with the plan, and they know that they've helped them. Ongoing challenge that I think is the members have is, how do we have a better perception of, did this, and I think this is something you talk about, Carla, did the plan help me, know me, and serve me more effectively and most effectively? And that's where we want to get to, because that does have impacts on both costs and retention.
Yeah, great points, Neal. I want to bring in a question. I'm seeing some great questions that are coming in on the chat. Kim asks, can you talk about measurement or metrics that matter in your organization? So yeah, great question, Kim. Carla, can you talk a little bit about the results, both, you know, from what you've been hearing from your customers and what kind of results you've been achieving for your business?
Yeah, I think there's 2 points that we look at that's really top in terms of metrics. Net Promoter Score is one of them, because that's there's a question on the scoring and the surveys that are provided around relevant, timely communication and ease of that communication. So in terms of understanding it. So NPS score is certainly something we go after. We're also internally going after a 100% paperless goal. And again, it's probably a lofty goal, and it's a North Star. It's something we're going out there and doing. And then we have digital adoption rates that we track. So how many of our customers are signing up for an online account, are taking advantage of that paperless option to receive communications and assets, and I call them assets, digital assets, like an ID card, digitally. So those are some of our big goals. Financials are, always something that we're thinking about, and lowering our administrative costs, right? So print mail is costly. So we have administrative budget targets that we go after to lower those print budgets right now, and make sure that as we move to that paperless and more digital, then we can reduce the costs, which in healthcare then reduces our overall cost to serve, which is really important. In the effort last year, something really tangible, we redefined our whole, as I mentioned earlier, our whole end-to-end members billing experience. And this is for our individual and family plans, where people pay their own good money to be insured, right? And so every month they get a bill to pay their premium, so they can keep their membership. And with doing that, we automated that process. We streamlined that process. We have auto pay, bill pay, things that they can just go online and pay their bill, or it automatically comes out of their account or their credit card. And then what we've done is we've also took an inventory of all of our communications that were printed and mailed. And we said, do we really need to send all these? Do we really need to have this many communications? So we actually eliminated some of the letters that we normally send, those that aren't the mandated or the regulatory letters. And then we also streamlined them. Some of them we reduced the page count by providing links available that they can go access, or a URL that they can go access to get additional information that we are required legally to say, right? Like at terms and conditions and things like that. And so as a result, last year, we eliminated over 9 million sheets of paper and 2 million mailings. And it sounds like a lot, but let me tell you, that's just the tip of the iceberg. That was like 1 year alone. So there's a lot more we can go after, but a lot of paper saved a lot of trees.
That's fantastic. We've talked about this from a customer experience perspective, and we've talked about it from lowering your cost and the environmental perspective as well. So that's phenomenal. We have a question that came in from Andras. It says, during the past couple of years in the banking industry, video calls, I'm going to take it off because it's covering Carla up. Video calls within customer care was always coming up as a hot topic in the banking industry. But all in all, the numbers usually not proving that it is really a preferred way for the clients to interact with their bank. What's your experience in regard to this in North America in the healthcare insurance industry? So I guess I'll kick this to either one of you, whoever wants to take this question. Video as a communication channel.
Yeah, let me start by saying we don't do it right now, not from a customer to like a customer service agent, or to a caseworker or care on the Blue Shield side. It's not something we've invested in. I've looked at it. It's video pop-ups in a chat, things like that could maybe provide beneficial. We haven't done it. The healthcare industry, the video comes in handy when you're actually doing like teledoc. I think Neal was mentioning moving to more of visual care conversations that we provide as a benefit. So that benefit makes it so that our customers, if they choose a virtual visit, they can schedule and go even through their online account and schedule and go get a visit through teledoc. But the one-to-one communications, like sending communications, talking to a member about when they call in, we don't do that yet.
Yep.
I would say we see the same thing, the personalized video approach from a servicing standpoint, being able to send it out through customer service. The demand has been much lighter than I think the market anticipated over the last number of years. But there is a hierarchy almost to the engagement paradigm. So for simple things, people would like to do text. They may end up, if it gets a little more complex, may do chat. So they elevate to different channels that may be more convenient to them based on convenience or a number of different items. But beyond a live video feed, like for telehealth in the healthcare space, I haven't seen personalized video as a trend being as big as it was anticipated a few years ago. It's still there, but I've seen it more on the selling side and acquiring and enrolling a new customer or member than on the servicing side. Have you seen the same thing, Carla?
Yeah. I mean, I like you said, it's still out there. It's still something you may explore for certain use cases, but you got to figure out what is that use case? What's that demand? What do you need it for versus just saying you have it? We have plenty of channels that exist today that were not even fully developed yet. Even our SMS text channel, we just launched last year, but we don't fully utilize that either. So we're learning.
Yep. Absolutely. And getting some agreement in the comments. We're getting some agreement. John agrees with the cost reduction and says save the trees. So fantastic. Totally with you on that, John. So a question for both of you. What were some of your biggest lessons learned over the past year? If you had to boil it down, what would you want to share with the global CX community? So Carla, let me start with you and then I'll go to Neal on that one.
So I think for us, we have to realize that our plans change along the way. You may have that North Star, you may have your priorities and things that you're going after. But then, for example, what Neal was mentioning earlier, then COVID hits, right? And you're like, okay, so what happens now when you're in the midst of a pandemic? So you have to quickly shift. And we did move all of our customer care and claims processors out to a remote workforce. We did that relatively quickly in a few weeks. But along with that came with, okay, now what were some of those business processes or things that we did in the office that we can't do now? And one of the things that we had done with smart communications, we have an ability to create, letters on the fly. Then we can print out those letters, and then our processors would manually walk down to our local mail room and say, please, mail this letter out to our member. Well, you couldn't do that anymore because you didn't have that process, that capability in your home to do that. So we quickly had to shift to figure out how do we offer these letters to our members and send them on email, post them on their message center. And that's the work that we had done and quickly turned around this year. And then we also had to work with our vendor partners who actually do the print mail for us and create that capability so they could do it on our behalf versus in our own mailroom. So that's just some of the things that we did to kind of shift and make sure that, you have a plan, you work a plan, but it will change, and you got to go with it and be creative.
Great insight. How about you, Neal?
I completely agree with you, Carla. I think one of the things that we learned is how quickly people, companies, payers could quickly adapt and be agile at the beginning of the pandemic, both from a business continuity standpoint, but also better engagement with their members and their commercial clients, their small businesses or businesses that they work with. One of the things that we've seen is this balance between agility and compliance. How do you get creative? Whereas the regulations say it has to be this way, is there any flexibility so we can move it digital? So being able to test some of the norms and doing what's right for the customer has been definitely a theme over the past year. I think we've also seen most recently with all the cyber issues that are going on right now, security and being able to make the access to the systems via the cloud, via whatever channels we need for both members as well as employees is key. So we've seen cloud adoption improve and grow, quite honestly, because people need access in the call center, the customer service centers. They need access remotely to do the same processes they do inside, but they have to be at the same level of security or better. We have HIPAA, we have infrastructure security protocols that we have to follow. So that is another high priority item that we've seen over the past year. Combining those together really gets us into an approach that allows that agility to happen more quickly and give us better results. I think if we want to learn anything from the pandemic, stuff happens very, very quickly. These black swan events can easily overwhelm us, but the industry stepped up to the task quite quickly.
Yeah. Great, Neal. Got some great questions coming in. I want to make sure I get to this. And if I don't get to your question, we can certainly try to see if we can get that answered in LinkedIn after the broadcast. But I want to bring in a question from John, who asks, this one's for you, Carla. If you could wave your magic wand to add or delete any regulations that would help improve the member experience, what would they be?
That's a good one, Carla.
It is a good one. I would just make sure that our regulators, Centers for Medicare, Medicaid, and our legal entities for TCPA guidelines, things like that, that are, making it difficult for us to communicate, just strip them out. Honestly, don't handcuff us. Allow us to honor our members' preferences and give them a digital asset and send it, email or wherever it needs to go, and not require us to mail. There are so many letters that are requiring us to print mail still today. So if I had my magic wand, just let us do what we need to do and make it right for our customers versus regulating so down to the very minimal level that we're handcuffed.
I think, Carla, we do have some precedent for that in looking at banking and the securities industry. A number of years ago, they said access is the same as delivery. If you sign up, you set it as your preference, it's available online, and you have access to that, and you get a notification, it's the same as a mail delivery. I'd love to see the regulators in the healthcare industry, especially both state and federal, look at ways to make that accessibility just the same as delivery.
Yeah, and just as a tangible example of what we can't do, and I want to wave my magic wand here, is that if our potential customer, they sign up to go paperless, and we do that at enrollment, and they say, yeah, I agree, they check terms and conditions and everything, we can't send them digital communications until they go in and create their account and validate that that's what they said that they wanted. We have to send them both communications until they actually went physically online and registered. And to me, that's wrong. If we know at the very beginning that they want paperless, send them paperless and not have to print right from the beginning.
Carla, I think you just solved a mystery of something that I've been wondering for a while. So, thanks for that.
Yeah.
So, with about 10 minutes to go, I want to get into one question on advice and one question around prediction. So, first question on advice. For those who may be watching who are, struggling to deliver more streamlined communications to their customers, they're struggling to sort of get their arms around, the myriad ways in which their organization is communicating with their customers that they may not even be aware of right now. What's your critical piece of advice? One critical piece of advice that each of you would share. Neal, I'll start with you.
I think the approach is one where, and Carla, I think you said it quite clearly earlier, having a team focused on this, getting them aligned and being able to go in and look at the content and do the inventory and challenge the process, look for better ways to be intuitive. Having a team that has metrics, that is defined and supported at an executive level, that has as part of their remit improving this process across the organization, not just at a single line of business or a single area, is fundamentally the way that we have to go to get this change in place to facilitate what the customers and our members want.
Yeah, great points, Neal. Carla, your thoughts?
Yeah, we have a practice of design thinking that we use, and design thinking is all about how do we know your customers, right? How do we be empathetic about them and their pain points or their journeys or what they're going through? And then kind of brainstorm creatively around, you know, what can we do? How can we help? You know, and build a backlog of ideas, right? And things that we can do, and then experiment on those ideas. Go after, you know, one or two small things, a proof of concept, you know, get the voice of the customer back on what you're doing, and really learn, so that you can take that input and feed it into that next best thing that you're going to do to make it easy and frictionless in how we communicate. So yeah, I think design thinking is always a good way to start.
Yep, absolutely.
And from a future perspective, if I can add to that real quick, Gabe, one of the things that we're seeing from a future perspective of where our clients are going, especially in insurance and healthcare space, is moving from communications, which traditionally is one way, moving from communications to more conversations. The more you know about someone, to your point, Carla, what are their preferences? How do they like to be engaged? How do we connect how they respond to us or how they can initiate a process? But we have this conversational approach with them. Moving from communications to conversations is really a priority for a number of companies, because they want to be able to fulfill something with a once and done. They want you to the know me conversation we talked about earlier. You have my information, show me you have my information and help me go through this. Don't ask them the same information twice. Make it more conversational versus just communicative.
Yeah.
Yeah, great prediction. Moving to this conversational space. Any other final predictions for the future of customer communications or customer conversation management, I should say? You know, when are we going to get there? Like, you know, let's go. When are we going? When's it going to happen? When's it going to happen? So, any final thoughts? Final predictions?
Yeah, I'm really optimistic, and I like the question around if you could wave your magic wand, because I do think if we could just all lean in any way we can, every opportunity we can to push regulators, push the envelope where you can, make big, bold decisions on our own. I know companies in the past, when I was more in a consumer product supply chain area, we had companies like Walmart that would just say no to things. Hey, if you don't send me an electronic information about your products, I'm not selling your products, right? So you got to take a stand, and we can't do it alone, because, you know, we need leverage, right? We're a much smaller company. So you have to kind of lock hands and try to push the envelope and continue to invest. I mean, we're going to continue to invest, and we'll modify as we go, and kind of figure out what works and what doesn't work, and just keep that eye on that North Star.
Keep your eye on the North Star. Great final insight. Carla and Neal, I want to thank both of you so much for taking the time to join us today. Neal, one final question. If those watching want to learn more about smart communications and your role in streamlining this, where can they go ahead and do that?
They can do that through, and we'll put a link into the description as well. They can go to smartcommunications.com. Feel free to also reach out to me on LinkedIn, or go to info@smartcommunications.com for our, if you have any requests for our marketing team.
Fantastic. Neal and Carla, thank you again so much. Great having you with us. Fantastic insights and conversation. Appreciate you both.
Thanks, Gabe.
We appreciate it. Thanks, Gabe.
Thanks, everyone.
Thanks, Carla. Good to see you again.
Questions.
Thanks, guys. All right. Sorry, Neal, for cutting you off right there at the end. Appreciate you having you on. And if you want to learn more and explore great conversations like this one, check out CXPA.org. Got a phenomenal resource library that covers content from each of the CXPA's knowledge domains areas to help you drive CX in your organization forward through design thinking, through CX strategy, through building a customer-centric culture, through metrics measurement and ROI, and building effective governance as well. So lots of great resources there. We hope that you are going to join us for our next conversation. We have webinars that are happening basically every week. Check out the event calendar on our site, and we'll see you back here on social media very soon. Have a great week, everyone. Talk to you soon.